Namaste, all the viewers of Analytica Ayurveda, and today we are discussing with the rule and regulations, and that is the one of the most revolutionary changes made by the Ministry of Ayush, Rule 158B. Yeah, and that was introduced in the August 2010, 10th August 2010, and it has a story why it was met, why this amendment was met, what was the need. I mean compulsory need, or in other words compelling need. Fine. So let us go through the rule 158B word by word, and then I shall make you some explanation wherever it is required. Open your book as the case. Whenever we interact on the rule and regulation, and there is the first phenomenon that open the book. So now book is open. Yours, mine is open. Yeah. So 158B, guidelines for issue of license with respect to Ayurveda, Siddha or Unani drugs. Here is a guideline for issue of license with respect to the Ayurveda, Siddha or Unani drugs. First A is the Ayurveda, Siddha, Unani medicine under section 3A. So Ayurveda, Siddha or Unani drugs include all medicines intended for internal or external use for or in the diagnosis, treatment, mitigation or prevention of disease or disorder in human beings or animals, and manufactured exclusively in accordance with the formulae described in the authoritative book of Ayurveda, Siddha, Unani tip system of medicine as specified in the first schedule. Do you remember, friends, where it was same? 98% same. Where it was? Expand your neurons. अक्सर मैं अपनी क्लास में ये बोला करता हूँ आपके साथ इंटरेक्शन में कि अपने न्यूरॉन्स को खर्च करिए. सिर्फ डिपॉजिट में आपने रखा है कि उसका मल्टीप्लिकेशन कराएंगे. थोड़ा उनको एक्सपेंड करिए, खर्च करिए अपने न्यूरॉन्स को, और बताइए कि ये सेम डेफिनेशन और कहाँ है. याद आया? चलिए, याद आ गया होगा आपको. सेक्शन 3A. Where? Section 3A of the Drug and Cosmetic Act 1940. Now this definition is here in the Drug Rule 1945 under the Rule 158B. Simple. Those medicines will be known as the classical Ayurveda medicines under Section 3A, which are from where? Which are just which are Ayurveda, Siddha, Unani drugs include all medicines intended for internal or external use, for use or in diagnosis, treatment, mitigation and the prevention of disease or disorder in human beings or animals, and manufactured exclusively in accordance with the formulae described in the authoritative books of Ayurveda, Siddha, Unani tip system of the medicine as specified in the first schedule. This section 3A is for the books which, let me clear, because I am getting a phone call from my boss, that is the office of the dean, and I have to convince him that I am here something in the academia. So sorry for interruption. Now I have kept my mobile in silent mode, and okay, fine. So start. So here the section 3A is saying that the authoritative textbooks, means they were notified in the first schedule of the Drug and Cosmetic Act 1940, and those books are all having that particular formulations in all books. This number is 54, 55 with the addition of the Ayurvedic Pharmacopoeia of India and the Ayurvedic Formulary of India. Rest all classical classics, literally right from the Charak Samhita to the Rastarangani, these all are there, and the formulas quoted in those books, if they are prepared as per the ingredients and as per the proportion given in there, is the same. and they are known as the section, they are issue license under the section 3A. They are the classical Ayurvedic medicines. Fine. Okay. You are all Sitopaladi Churn to the Vagri Haritaki, to the Vasavale, to the Asoka rest, Arjuna rest, everything is there, and all there are the classical Ayurvedic medicines. Yes, you can take Samir Pannag Ras, you can take Ras Sindoor, you can take Arogyavardhani Ras, you can take Chandraprabha Bhatti, you can take anything which are in the classics, and in the broader sense, which are compiled into the Bharat Bhaishaj Ratnakar, or which are compiled under the Ras Yog Sagar. Almost all of them, because there are some books which are not listed, they are in the compilation but not listed into the schedule first. Except those, they all are the classical Ayurvedic medicine and licensed under the Rule 1, Section 3A, under the Rule 158B. Now, the patent or the proprietary medicines under Section 3H. So, I need here to explain here the two words, patent and the proprietary. So, this patent has nothing to do with the Patent Act 1970. This has nothing to do with the Patent Act Amendment 2005. Means the name patent which is in your mind, that has not applicable here. This patent and that patent is entirely different. Here is the mainly those are the copyright and the proprietary medicine, because that patent is something different. The knowledge should not be in the public domain. The first thing, there must be the nobility, there must be the invention, there must be the industrial application. Yes, invention may be, but the industrial applications may be, the nobility may be in your whatever the you are seeking for a patent, but the where the lacuna as nowadays, even in this 2023, is that the whole literature is in public domain. So if it is a traditional knowledge and the literature is in the public domain, one cannot patent. So the word here is just that patent, which is fancy patent, not the real patent, and the proprietary, the copyright is the right. Fine. Now come, what is the definition? Yes, go. Patent and proprietary medicines under section 3H. In relation to Ayurvedic, Siddha and Unani tip system of medicine of all formulations containing only such ingredients mentioned in the formulae described in the authoritative books of Ayurveda, Siddha or Unani tip system of medicine specified in the first schedule, but does not include a medicine which is administered by the parenteral route, and also a formulation included in the authoritative books as specified in the class A. ये बड़ा specific thing है, and I have explained it very well, and if you need to go, then go to the my all videos uploaded on the Analytica Ayurveda, and it is just in the first 2 or 3 video you will get the whole explanation of the section 3A and the section 3H. So here in this case, those formulae which are under the which may be licensed under the section 3A, all their ingredients, and if the having similar pharmacological action or a disease where the some synergistic action is required, and those ingredients are taken from those formulas, and then a medicine is being prepared, it is not that the same ratio as the case is with the section 3A. Here may be the different technology or the different presentation, that with those all are the proprietary medicines of Ayurveda, and those all are the proprietary medicines of Ayurveda and under section 3H. And in this amendment of the August 2010, 3 subdivisions are added which were not earlier, and these 3 subdivisions are Balya, Saundarya and Aushadh Ghan. Before going to the detail of the Balya, Saundarya and Aushadh Ghan, here I want to emphasize before you all, आप सबके सामने ये बताना ज़रूरी है कि ये अमेंडमेंट क्यों लाया गया. क्या आवश्यकता थी। तो फिर वही पुरानी बात कि वेस्टर्न इंटरेस्ट बहुत ज़्यादा बढ़ा आयुर्वेद के प्रति, हर्बल मेडिसिन्स के प्रति, और यहाँ सबको ये दिखाई दिया कि हम जो है कुछ अच्छा कर सकते हैं, अच्छा हमको बिजनेस अपॉर्चुनिटी है, एक्सपोर्ट की संभावनाएं हैं। तो उन्होंने कहा कि ठीक है, हम जो जितने भी मैन्युफैक्चरर्स थे, लीडिंग मैन्युफैक्चरर्स, जिसमें कि आप सबका नाम ले सकते हैं, जिनका कि टर्नओवर 500 करोड़ के ऊपर का है, आपका दूध पापेश्वर हो गया, चाहे डाबर हो गया, चाहे एमिल हो गया, चाहे ये इमामी हो गया, ये जितने भी लोग हैं ये टॉप, they went to the government and they demanded that here is a market. Which market? That is the nutraceutical market. Where the market? That is the market in the Cosmaceutical. And where is the market? Market is in the supply of the extract of the plants. Right? So they convinced the government first, and then government thought out it. Government means Ministry of Ayush, right? Department of Ayush at that time, because ministry was in the 2014. So the department expert committee dealt with all these demands and the representations of the manufacturing units of the Ayurveda, and then they realized, yes, they are true. The demand of the manufacturers are very justified, and if we will not do that, we are losing something which is known as commerce, which is known as business. We are not helping the Indian economy to boost. So these amendments were made there into the Drug Rules 1945, at that time Drug and Cosmetic Rule 1945. Okay, so the Drug Rule 1945 is added, and this different license category was initiated into the August 2010. We will go what are that. So the first category is here: Balya, Poshak, Mukavi. In Siddha it is the Nutraceuticals, and the one more addition, that is the positive health promoter. So they said कि Balya, Poshak, Mukavi, Nutraceuticals, positive health promoter formulations having ingredients mentioned in books of the first schedule of the Drug and Cosmetic Act and recommended for promotional and preventive health. सारी खेल यहीं पर है. कोई भी हमने इंग्रेडिएंट निकाला, ज़रूरी है कि वो इंग्रेडिएंट सेक्शन 3H ऑथोरिटेटिव टेक्स्ट बुक के फॉर्मुलेशंस में हो. वहाँ से उन इंग्रेडिएंट्स को लिया और एक हमने बना लिया जो कि हमारे लिए पौष्टिक है, शरीर को पोषण प्रदान करता है. और वो पोषण प्रदान करने के क्रम में हमने उसकी एक सब कैटेगरी बना दी बल्य. उसका नाम पोषक भी दिया, पॉजिटिव हेल्थ प्रमोटर भी कहा, और उस नाम से मार्केट में बहुत सारी चीज़ें अवेलेबल हैं. इसको कंफ्यूज मत करिएगा. कहाँ से? ये मेडिसिन है, और वो जो आयुर्वेदिक आहार है और जो आयुर्वेदिक न्यूट्रास्यूटिकल की बात होती है वो न्यूट्रास्यूटिकल है. वहाँ मेडिसिनल क्लेम मस्ट नहीं है. यहाँ एक मेडिसिनल क्लेम कर सकते हैं, और वो भी मेडिसिनल क्लेम कैसा? क्योंकि इसकी लाइसेंसिंग सेक्शन 3H में हो रही है. तो सेक्शन 3H इज़ मीन्ड फॉर द फार्मास्यूटिकल्स. इसको आप ऐसे बोल सकते हैं, सॉरी, टॉनिक के रूप में. सॉरी in Varanasi since last 3 days it is raining, and so this is the impact of the rain, my dear friends. So the Balya, Poshya, I wish to clear here again, Ayurvedic nutraceutical or Ayurveda ahar is something different. They are not licensed under the section 3H or under the Ayurvedic Aushadhi. Here this Balya or this Poshya or this Mukavi, or in the Siddha it is the Nutraceuticals, these are the positive health promoter. Of course here you can make a claim But in the Ayurvedic nutraceutical or any other nutraceutical, you can't make a claim that it is good for the angina pectoris, or it is good for the tuberculosis, or it is good for the osteoarthritis. No, in the nutraceutical case you can't. In Ayurveda Ahar you can't. If licensed under a product licensed under the Ayurvedic Ahar, there should not be any medicinal claim. I mean therapeutical claim, clinical claim, pharmaceutical claim, pharmacological claim. There is a lot of name, but all these names are not synonyms. Yes, once again, I make a precaution here. Whatever I just pronounce these 3-4 words, they are not synonyms, not at all. Fine. So here, if you see, the difference is from the nutraceutical to this Balya Poshak is here you can have medicinal claim, because these are licensed under a medicine. So this category is required specifically for the export, easiness in the export. All these 3 varieties are just added in August 2010 for the purpose to enhance the export capacity of the country Bharat. These all Ayurvedic manufacturer units are demanding in the same way. If you see here, Saundarya Prashadak, its Unani names is there, Hussain Afja, Ajgal Sadhan formulations having ingredients mentioned in books of first schedule of the Drug and Cosmetic Act and recommended for oral, skin, hair and the body care. Is there a need to explain? Once again, the whole business of the cosmeceuticals and specifically the herbal cosmeceuticals, and there is the introduction of the Cosmetic Rule 2020, which was just separated from the Drug and Cosmetic Rule 1945. The Drug Rule 1945 and the Cosmetic Rule 1945, Drug Rule 1945 and Cosmetic Rule 2020. So the Cosmetic Rule 2020 is giving a very elaborative explanations for what are the cosmeceuticals and what are their objectives and how they may be licensed and how they may be produced for the national market or for the global market, right? Here in the case of the Rule 158B of the Drug Rule 1945, here your Saundarya Prasadak may have the therapeutic claim. If it is issued under this category, what I am understanding, you can claim it may be useful in the case of Vyang. It may be useful in the case of the anything which is invited there, which is there for the particular diseases which are just even the scar of the wound scar, or even the pregnancy scar. Many things are here which are just coming in my mind to take for an example, right? So if you are talking about that and if you are thinking about that, the simple point is that this Saundarya Prasadak, Husme Afja, Ajnaf Sadhan formulations having ingredients mentioned in the book of the first schedule of the Drug and Cosmetic Act recommended for oral, skin, hair and body care. Oral, चलिए एक सवाल पूछते हैं आपसे, दंत कांति क्या है? कॉस्मेस्यूटिकल लाइसेंस दंत कांति का आयुर्वेदिक प्रोप्राइटरी मेडिसिन के रूप में लिया गया है, तो कहाँ से दिया गया होगा, कैसे दिया गया होगा? क्या इसके अंतर्गत रूल 158B क्लॉज में, या स्किन के ऊपर बिको वज्रदंती टर्मरिक, और बताइए हेयर ट्राइचेप ऑयल, केस किंग, सब एग्जाम्पल्स हैं, मार्केट में अवेलेबल हैं, हिमताज तेल, कूल कूल, ठंडा ठंडा। और बॉडी केयर, कोई भी चीज़ इस तरीके की जो यूज की जाती हो, की जा सकती हो, कॉस्मेटिक पर्पज उसका हो। तो कॉस्मेटिक की डिफिनीशन क्या है, याद है किसी को? मैं ऐसे ही बोलचाल की भाषा में बोलता हूँ कि वो कोई भी वस्तु जिसका उपयोग किया जाए जो कि किसी कमी को छुपाए, जो हो ना उसे दिखाए, जो जैसा कोई है उससे भी बढ़ा चढ़ा करके ग्लो कराए, किसी चीज़ को छुपाने में सक्षम हो, अपीयरेंस बढ़ा दे, ये सारी चीज़ें कॉस्मेटिक्स के पर्पज़ हैं। क्लिनजिंग करे और भी चीज़ें करे। तो जनरली जो इसका यूज़ होता है वो कॉस्मेटिक्स का यूज़ करते हैं। मैं इसको एक बड़ी ब्रॉडर सेंस में अगर ले जाऊं तो ये कहना चाहूँगा कि इसके बड़े पॉजिटिव रोल्स हैं, यूज़ किए जाने चाहिए, क्योंकि एवरी पार्ट ऑफ द बॉडी नीड केयर। Here is the word body care. Every part of the body need care with the specification. It is not just like the nails, hair, eyes, the face, and the pedicure and the manicure. All these things which are used, and it is not that it is the fashion. Fashion up to ultra level is really maybe a point of discussion, a point of concern. When you are changing everything of your body under the fashion, applying the chemical things, synthetic things for a different purpose, that cannot be appreciated. But if you are caring your body, any part of the body, नक से सिक या सिक से नक, with the all herbal appliances, with a specific purpose to nourish that part, to make that body part its functions easy, then the cosmetics are appreciable. And of course there is a one word that is known as the level of confidence in your presentation and presentation of yourself. This is not PowerPoint presentation, presentation of yourself, how you look, how your hairs are look in the class, how your hairs are appearing in a marriage party, how your hairs are appearing when you are appearing for an interview, how your hairs are appearing when you are going on an international delegation. So all these four things required four different kinds of the hair, and all these things are possible only if they will apply the different things, kinds of the cosmetics available, and in a proper ratio, in the proper way, proper manner, appropriate things. So these market of the cosmetics are very high. See the face wash, a simple thing. Many people who are coming to their job, their profession, there is a need to look smarter, so they use all these things. And really the application of face wash in evening hours when you are tired, and then you are just applying that and getting a freshness, and then you are on air, in air or leading and talking or the teaching in your class simply then that is the cosmetics. So looking the market of all these things all across globe, these manufacturers convince the government that here is a need of category known as Balya Poshak, because the nutraceutical is having a different market. This projection is very high, up to 2050. There is no downfall. The same way the cosmeceuticals, the projection is very high. But those nutraceutical and cosmeceuticals are different here in this case, because here the Balya and the Saundarya Prasadak may have, and if licensed this category, may have some medicinal claim, medicinal value, but those not. Those are only for the pure purpose of the nutrition, and they are the pure purpose for the cosmetics. That is the best difference, most evidence difference between these two. The next variety is Aushadh Ghan. Medicinal plant extract, dry, wet. Extract obtained from plant mentioned in the books of the first schedule of the act, including aqueous or hydroalcohol. Yes. The point is, extracts of the medicinal plants which are quoted into the formulae of the authoritative textbooks. If business of extract is also very high, and see the different kinds of the capsules from the organic or from the Himalaya or from the any other companies like Ayurveda, Nutraceuticals. So they are supplying it under the somehow in the dietary supplement category or in the FMCG or just like a plant product with the no pharmaceutical claim, no therapeutic claim. But here one can use it for the therapeutic claim also, because if it is licensed under in India, Rule 158B, and the clause 4th is here of the B, first take a B, certainly you can claim here some medicinal value too, because it is licensed under a Ayurvedic drug. And these extracts are being exported. There are the different varieties, ready to use, mixed to use, many level at the importing country, repacking, relabeling, many more things are there. But at this site, when I am counting the rules and started from rule 157 and will go to the rule 170, see my final year students who are supposed to be appear into the final year examination in the month of January, they approached and said, sir, इस स्पीड से तो पूरा नहीं होगा, हमको अलग से पढ़ा दीजिए ये सब चीज़ें. तो हमने कहा ठीक है, वो तो हम हर साल करते हैं, ये तो यूट्यूब बिजनेस अभी यूट्यूब हॉबी अभी शुरू हुई, या यूट्यूब बिजनेस कह लीजिए अभी शुरू हुई. हम लोग जनरल बिजनेस वर्ड यूज़ करते हैं, नॉट फॉर द कॉमर्स. हम लोग बिजनेस वर्ड अपने एकेडमिक एक्टिविटीज़ के लिए भी यूज़ करते हैं कि दिस इज़ नॉट योर बिजनेस टू मूव हियर एंड देयर, योर बिजनेस इज़ टू बी very careful in your academia. So I am trying to get it done in a speedy way for those people. But here if you see, all these four are really good, and they are in the market, they are having the business in the market, and this Aushadh Ghan, and the point is the only thing that they are from the alcohol, hydroalcohol, not pure alcohol, and the aqueous. Those extracts which may be from the other chemical solvents, which are a lot, those extracts cannot be licensed under this category. Here only two variety of the extracts may be licensed, and that is the aqueous and the hydroalcoholic. So for today interaction, just this is enough, and next time we will start rule 158B second A, and here the some good tables which are really very important, and I shall come with this explanation of all these tables which are required by the even synopsis review committee or the ethics committee, what kind of the drug is permissible, where clinical data is required, where toxicity study is not required, all those things. So wait for the next interaction, and we will cover it. Thank you, and be here, be aware, watch this, and subscribe more and more. Thank you. Namaste.